Welcome to the front lines of healthcare, critical care nursing in the ICU, where every decision impacts a life. Let's begin with ICU basics, the foundation of a nurse's journey in this high-stakes environment. Patient care is paramount. Understanding their needs is the first step to providing exceptional care. Critical care procedures are complex. Mastering them requires focus, precision, and a steady hand. Nursing responsibilities extend beyond the bedside, encompassing a holistic approach to patient wellness. In the ICU, every monitor and beep tells a story, a narrative of the patient's current state. When complications arise, it's the nurse's swift intervention that can turn the tide. Communication is key. Clear dialogue between team members ensures the highest level of care. Administering medication requires accuracy. A nurse's vigilance can prevent critical errors. Emotional support is part of healing. Nurses often provide comfort in moments of vulnerability. Advanced technology in the ICU enhances patient care, but the human touch remains irreplaceable. Documentation is meticulous in the ICU. Every detail contributes to the continuum of care. End-of-life care is a profound responsibility. Nurses ensure dignity and compassion until the last moment. Continuous education keeps ICU nurses at the forefront of medical innovation and patient care excellence. Thank you for joining us on this journey through ICU nursing, where every day is a testament to resilience and skill.